Hello and welcome to the Wellness Oracle. I am Dr. Praveen Ravishankaran, consultant surgical oncologist and robotic surgeon in the beautiful city of Coimbatore. Over the years, I have had the opportunity to treat a large number of patients with carcinoma breast from very early stage cancers where we can preserve the breast completely and to more advanced diseases requiring complex multidisciplinary care. My work has been deeply focused on minimal invasive and robotic cancer surgery, but more importantly on helping patients understand what they are facing. Because when you understand the disease, you stop fearing it blindly and start dealing with it more intelligently. Today, I want to talk to you about something extremely important, the basics of breast cancer. Not in a very complicated medical way, but in a way that actually stays with you. Let me start with something very simple. Imagine you take a lemon and you add a spoon of baking soda onto it. Instantly you see bubbling, fizzing, a reaction that almost looks playful. At first glance, it feels harmless, almost trivial. But what is actually happening is far more complex. There is a chemical reaction taking place at the microscopic level. Molecules interacting, breaking, reforming. You don't see that depth. You only see the surface effect. Now, hold on to that image in your mind. Think of that beautiful scene from Moana. Where a young child walks towards the ocean on the first time. She does not understand what the ocean is. She does not know its depth, its power, or its significance, but she feels drawn to it. And the ocean gently reaches out to her, touches her feet, almost like it actually communicates with her. At that moment, something meaningful has already begun, even though she does not yet understand it. Breast cancer often begins in exactly the same way, quietly, subtly, without pain, without drama, and very often without being understood. Now, let's simplify this. Our body is made up of billions and billions of cells. And these cells follow a very disciplined system. They grow, divide, perform their function, and die at the right time. It is a highly regulated process, but sometimes, due to changes in DNA, what we call as mutation, this control is lost. A group of cells in the breast starts behaving abnormally. They grow faster than they should, they don't stop when they should, and they don't die when they have to. They simply keep on multiplying. Initially, this happens at a microscopic level, completely silent. Over time, these cells accumulate to form a small lump. This is usually the first thing that the patient notices, but here is something very important. Every lump is not cancer. Many breast lumps are benign, conditions like fibrinoma or cyst. However, from the outside, you cannot reliably differentiate a harmless lump from a cancerous one. And that is why every single lump needs proper evaluation. As these abnormal cells continue to grow, they don't just stay confined. The breast has lymphatic channels, especially draining into the armpit. Cancer cells can enter these channels and then spread to the lymph nodes. From there, if not treated in time, they can travel to other organs like the lungs, liver, bone, and brain. This is what we call metastasis. And this is when a localized disease becomes a systemic one. Now, one of the most common questions I hear is, Doctor, I don't have a family history. How did this happen? And this is where a major misconception needs to be corrected. Yes, genetic mutations like BRCA1 and BRCA2 increases the risk. Yes, the family history is important, but the reality is that only 5 to 10% of breast cancers are hereditary. The majority happens due to a combination of factors: age, hormonal influence like early menstruation or late menopause, lifestyle factors like obesity, lack of exercises, and sometimes reasons we still don't fully understand. So, not having a family history does not mean you are not at risk. Now, let's talk about how breast cancer presents, because this is where awareness truly saves life. The most common presentation is a lump in the breast, and very importantly, it is usually painless. This is one of the biggest dangers. Many people wait for pain as a warning sign, but early breast cancer does not hurt. It sits there quietly. Other signs may include changes in the size and shape of breast, dimpling of the skin which may look like a surface of an orange, the nipple getting pulled inside, an abnormal discharge from the nipple, especially if it is bloody. Sometimes there can be redness or thickening of the skin. These are all signals that your body is giving you. Now let's get back to the lemon and the baking soda. What you see was a visible reaction caused by an invisible process. This is exactly how cancer behaves in the early stage. Inside the breast, at microscopic levels, cells are dividing abnormally. Signals are changing and the environment is evolving. But externally, you may not notice anything but only a small lump, or sometimes nothing at all. The visible changes are minimal, but the underlying process can be significant. And this is why screening becomes so very important. Especially for women above the age of 40 years, mammography can detect breast cancers even before they become palpable. It allows us to catch the disease at a stage when treatment is simpler, outcomes are much better, and in many cases, the breast can be preserved. So if you think back, Moana did not ignore the ocean. She stepped closer, she engaged with it, and that changed everything. In the same way, when your body gives you a signal, even though a small one, you must respond. Don't ignore it. Don't delay it. Don't assume that it will go away magically. Because when breast cancer is detected early, the prognosis is excellent. Treatment can be less aggressive, recovery is faster, patients can go on to live completely normal lives. Breast cancer is not just about the disease, it is about the timing. Early detection changes everything, and that is exactly why Wellness Oracle exists. To simplify complex medical concepts, to remove fear, to break myths, and to give you the kind of knowledge that can actually save lives. If this video made sense to you, and it has helped you to understand breast cancer even a little better, I want you to share this with your family, especially with the women of your life. Encourage awareness, encourage screening, and more importantly, subscribe to the Wellness Oracle. Because in the next video, we are going to talk about the treatment options, the latest advances, and how technologies like robotic surgery is transforming outcomes in cancer care as a whole. I'm Dr. Praveen Ravishankaran, and always remember, early detection saves lives. Don't ignore the signs. Thank you and have a nice day.